So these are the diseases of the eye orbit and the eyelids. What's the orbit? It's basically just like the eyeball itself. The eyelid covers the eyeball. So there are loads of orbital diseases. So I'm basically going to list them and just go through them and just show you what they look like so you can describe them yourself. So there are two types of orbital diseases: congenital, so what an animal's born with, and acquired. So we'll go through the congenital first. So you have exophthalmos. Exophthalmos is where the globe protrudes. You can see it's coming out. Whereas in enophthalmos, the globe basically retracts into the orbit. Sorry, I was wrong about the orbit. So it's not the eyeball, sorry, it's the where the eyeball sits. So it's basically the bone part around the eye. So yeah, exophthalmos protrudes out of the orbit, enophthalmos protrudes in. And basically, why will we see exophthalmos? It's usually seen in more shallow orbit cases. So basically, the pit that the eye sits in is very small. And what this can lead to is corneal abrasion. So basically, the surface of the eye will have a bit of rubbing on it. Proptosis, so the eye could even pop out, and keratitis, so not only rubbing of the cornea, but this can lead to inflammation of the cornea. What else? So there's something called extraocular muscular agenesis or hyperplasia. So basically this leads to hypertrophy of the eye, which leads to blindness. I'm trying to find it. I think this might be it. I'm not sure. But yeah, that's what extraocular muscular agenesis hyperplasia is. So basically these are the muscles around the eye. They are not formed or not formed very well, and this leads to the eye looking very large, and it leads to blindness. Now we'll move on to the acquired diseases because there are so many. So first we have orbital cellulitis or abscesses. Yeah, so abscesses, we know it's because of infection, so we know it's acquired. So why has this happened? Simply because of trauma with dirty material. Maybe something sharp has penetrated, like we can see the conjunctiva here, but it's also dirty. So what happens is the periocular tissue is inflamed, and this can lead to not only abscesses and stuff, but other diseases quickly. Because, for example, it's hard to open the mouth. We can see conjunctivitis in this case. So how do we diagnose this? We can image it. But we can also use FNA with general anesthesia. I'd probably do general anesthesia personally. So yeah, you just get a fine needle and aspirate. And then you'll treat it by, yes, draining the abscess, adding antibiotics and anti-inflammatories like corticosteroids. Now, there are also orbital fractures. Let's see. Do we have any pictures? Yeah, okay, woof, okay. So an orbital fracture, so this is where a bone in the orbit has fractured. So the example here is the zygomatic arch under the eye has fractured. What does this result in? You can see it bleeding, swelling, the globe itself is displaced, and as you can imagine, the dog is in a lot of pain. How do we treat this? There's something called a transorrhaphy, whatever that is. You can also use artificial tears to basically protect the cornea because, you know, the eye is swelling. And what happens is you can only do internal fixation of the fractures if it's more displaced. So let's say it's worse than this, you'll have to like find a way to basically cut the skin open under general anesthesia and, basically fix the bone in place. Orbital neoplasia, we know what that is, it's cancer, it's not good. Jesus, okay. So orbital neoplasia, it leads to other diseases, basically exophthalmos, I'm trying to find it, okay, the eye popping out, displacement, swelling, third eyelid protrusion, so, you know, this is the eyelid from the medial canthus, if no one's sure, blindness, and keratitis, so this is inflammation of the cornea. So how do we diagnose this other than just looking at it? Imaging, of course, because, you know, we might just see the eye and think, what the hell's going on? Only an x-ray can tell us, oh, there's a cancer mass under the eye. We can do a biopsy, so we can literally take something foreign looking in the eye and look at it through cytology and treat it. So we can operate, we can get rid of the tumor, we can do chemotherapy, or an orbitotomy, which is basically you cut out where the eye should be sitting. I don't know if they even showed it. Yeah, probably best not to. Right. Oh, and there are also vascular anomalies. So this is where you have orbital varices, for example, or arteriovenous fistulas. So we know fistulas usually occur because of infection. So what happens is these vascular anomalies reduce the venous return to this area, and this can cause intermittent exophthalmos. So basically, I think because the eye itself isn't getting enough blood, it kind of starts to pop out the eye. And you can do something called exenteration and hemostasis, but they're very risky. So we'll move on to eyelid diseases. I'm trying to do this as fast as possible. Okay, because there are so many. All right, so this is clearly acquired. This is an eyelid laceration. We can guess the causes, so I won't go into it. Clinical signs, you can guess. Diagnosis, you can see it. So I'll talk about treating. So we can do something called debriding. Debriding is where you remove just the damaged tissue because it's going to go necrotic. It's not going to survive. And you can just suture together what's left. And of course, you will use antibiotics in this area because maybe something dirty caused this. Anti-inflammatory, of course. And of course, dogs as well, they'll tend to port their eye. When they're in pain, they'll like do this. So use an Elizabethan collar. There are also skin diseases that can, trying to find something. Okay, let's just use this as an example. Skin diseases like parasites, like ticks. So Dermadex ticks, for example. Funguses like dermatophytosis. Protozoa like Leishmaniasis. Viral diseases like the pox. Bacterial diseases like leprosy. Allergies like dermatitis. And pigment diseases like vitiligo can lead to, hair loss around the eye and inflammation and all these other things. Basically, skin diseases connected to the eye can affect the eye, and you can bullshit that a bit. Blepharitis, is it here? There are so many pictures, so it should be here. Yeah, so this is just showing you an example of one of these diseases. So this is feline herpes virus. So this is an example of a virus, pox virus, causing dermatitis around the eye, which, there you go, blepharitis. Yeah, causing dermatitis around the eye, causing hair loss and a number of infections and things. So blepharitis is eyelid inflammation. It's kind of similar to what I just mentioned, actually, except, blepharitis is more of a symptom. It's not a diagnosis. Whereas like a diagnosis would be naming a disease. So blepharitis is more of a consequence of one of these diseases. Let's say in cats we have feline herpes. It leads to, as you can see, hair loss, alopecia. It can lead to crusting. I don't know if we can see it. Yeah, ooh, okay. Crusting, keratitis, so inflammation of the cornea, and conjunctivitis. You can even see some mild conjunctivitis in this bottom picture here, just inflammation of the conjunctiva. And you'll diagnose this through cytology, so get an eye sample and treat it using just some compresses, some warm compresses, and you would operate to remove the etiology. So for example, we talked about neoplasias before. It can actually cause blepharitis. And of course, drugs, like if it's an allergy, you'll use antihistamine. It depends on the etiology. The next disease that I'm mentioning is a stye. What the hell is a stye? Okay, so a stye is a bacterial infection that usually is in the meibomian gland. So it leads to this sort of mass, let's say next to the eye in the eyelid, and it causes swelling, pain, conjunctival hyperemia. So that means like a red conjunctiva and ocular discharge. And you treat it using antibiotics like chloramphenicol. I only know this because I get styes too, and they're god awful. The signs are also related to the meibomian gland's role in tear secretion, because just remember, in dogs, styes usually occur in the meibomian gland. So it's going to also maybe cause dryness of the eye. When we see dryness of the eye, we'll see greenish discharge. You're smart, you can go from there. Okay, so next we have chalasia. Where is it? There you go. Okay, chalasia. So chalasia, basically, these are also related to the meibomian gland, the clinical signs. So basically, this is when the meibomian gland itself enlarges because it contributes to tear production, it can also have its own ducts, and the ducts can be blocked. So yeah, that's what chalasia is. The meibomian gland has enlarged because its ducts are blocked. So the treatment's quite simple. You drain the meibomian gland, and maybe you could also flush it so you can get rid of the blockage. We already talked about neoplasia in the eye orbit. Eyelids can also occur. I'm just going to say an example like papillomas. So this could be a papilloma, for example. Next, we have coloboma. Don't worry, this isn't a type of cancer. It's just another eyelid disease. Okay, so these are more congenital, I'd say. So a coloboma is when there's a notch defect. So basically a part of the eyelid is missing. And it's usually the upper eyelid, and you can operate the dog at 6 months. So yeah, you use general anesthesia for that. A dermoid, yeah. Okay, is where you have tissue that shouldn't be there. So like skin with hair, for example, is quite common. And it's congenitally misplaced and you just remove it through an operation because it causes irritation of the eye. Next you have, ankyloblepharon. These aren't great pictures, but I'll try and explain it. This is where the eyelids basically fuse together because of a bacterial infection. And actually this has happened to Menor, so I've seen it. You have macroblepharon, so this is where the eyelids are like kind of too much, as you can see. And it can lead to other diseases like entropion. So for example, the eyelids can turn inwards and the eyelashes can actually penetrate the cornea. Ectropion is literally just the opposite. So let's say in this case you would see ectropion. And next you have microblepharon. So what does bleph mean? Bleph always means eyelids. Like we mentioned blepharitis, micro means small. So you can guess it's like small eyelids. Yeah, I don't really need to go into that. And then you have lagophthalmos. So lagophthalmos is when the eyelids don't close completely. Why is this bad? Because the eyes go dry. This leads to other diseases. We won't go into it. Next you have ptosis. Is it here? Yeah, so ptosis is where the upper eyelid literally droops. Oh, okay, so I mentioned ptosis before. I thought it was the eyeball popping out. I was wrong. It's where the upper eyelid droops, and this is a congenital issue, maybe because of the nervous system, because of the muscles. So you basically have to just cut and suture it. There's also trichomegaly. They had a really good picture here. Yeah, I skipped loads of diseases because we know what entropy and ectropion are. So when you mention them, you can just talk about them. So trichomegaly is you have really excessively long eyelashes. You can imagine this causes issues. There's also ectopic cilia. So these are basically, trying to find them. Yeah. So this is basically where you have, this is a very good picture. Hairs growing in the wrong place, so they can penetrate the eyeball basically. So yeah, they can emerge from the meibomian gland through the conjunctiva, and this can cause a corneal ulcer, and you'll remove it through cryo or electroepilation. So what cryo or electroepilation is you use extreme cold or electricity to basically remove this, sorry, I'm trying to sort out my papers, these hairs. So this is cryoepilation, extreme cold, and electroepilation to basically remove these extra hairs, these ectopic cilia penetrating the eye. And I'm really sorry, there are so many diseases here, so I skipped a few. Next I'm going to talk about is cherry eye. There we go. So what the hell is cherry eye? Because I don't know. It's when the third eyelid has prolapsed in the medial canthus, and this leads to corneal ulceration. And you can see why. It rubs the cornea. So you have to operate it using the pocket technique and using antibiotics. But we don't use steroids because it disrupts the healing process.